Welcome everyone. Today's webinar, our topic is Multiplying the Challenge, Parenting as a Disabled Immigrant. We have two awesome panelists join us today sharing their experience, Jennifer and Angelica. I'll just call them Jenny and Angie as they prefer to be addressed. I'm the facilitator today. My name is Luanjiao Aggie Hu. I'm a postdoctoral research fellow at Lurie Institute for Disability Policy at Brandeis University. I will give a more detailed introduction of myself, and the panelists later in the slides. And before we get started, there are some logistic notes. So today our event is supported by ASL interpreters and Spanish interpreters. If any of you need interpretation, you can turn that on. At the bottom of the Zoom screen, there is an icon that looks like a globe. You can click it and then select either ASL interpretation or in Spanish language there. Or we also have auto caption enabled here. You can turn that on from the CC button at the bottom of the Zoom screen. Okay. This event is organized by the National Research Center for Parents with Disabilities. This center, one second, The center is a cross-disability initiative guided by the ethos of disability community, nothing about us without us. Through services, research, and advocacy, the center provides instruction and information about health and parenting services for parents with disabilities and their families. The center is part of the Lurie Institute for Disability Policy at Brandeis University and is supported by the National Institute for Disability, Independent Living, and Rehabilitation Research and the Lurie Institute for Disability Policy. And this event is founded, the contents of this presentation were developed under a grant from the National Institute for Disability, Independent Living, and Rehabilitation Research, NIDLR. NIDLR is a center within the Administration for Community Living, ACL, Department of the Health and Human Services, HHS, and the content is solely the responsibility of the authors and does not necessarily represent the official views of NIDLR, ACL, or HHS. In terms of language, we acknowledge the diversity of gender identity, sexual orientation, and gender expression, and strive to be as inclusive as possible. Unfortunately, a lot of national data sets about parenthood typically record sex assigned at birth rather than gender identity, and rarely include information about transgender and non-binary parents. We do acknowledge that limitation, but we try to be as inclusive as possible. Like I mentioned, I'm the facilitator today. I'm a postdoctoral research fellow at Lurie, but at the same time, I identify as an immigrant. I came to the US in my mid-20s to pursue graduate studies here. But recently, I have been a person with a physical disability since a young age. And recently, I gave birth to my son and become a disabled parent. I've also shared my experience of mothering at the intersection, which is published as a blog in our Center for Parents of Community blog. I welcome you all to check our blogs there. And before I really introduce our panelists, I also want to give a brief background about our webinar today, especially about disability and immigrants in the US. So in the US, according to the census data in 2020, about 1 in 4 people, that's 27%, people here in the US live with some kind of disability. This may be more, prevalent than a lot of people think. But, disability, in the US, the definition includes a variety of disabilities, including learning disability, invisible disability, etc. And in terms of disabled parent, about 1 in 10 children in the US have a disabled parent, based on the research conducted by my colleagues here at Lurie. And in 2021, in the US, there are about 45 million people who are immigrants. These are people who were born in other countries, and they account for about 13.7% of the US population. Top origin countries of immigrants are from Mexico, China, India, Philippines, and El Salvador. I think because I'm an immigrant from China and then my partner is an immigrant from India, this data is really like not surprising to us, but still interesting to know. Most immigrants here in the US are here legally. And I know the participants here, but the panelists and the facilitator, we represent the perspective of immigrants who are illegally, but unfortunately, we don't have undocumented immigrant who can share their perspective in this webinar. And so I hope in our audience, maybe some of you may bring that perspective in as well. Some continued background. A lot of existing research focused on disability and immigration, focus on immigrant families, parents raising children with disabilities. But the perspectives of parents with disabilities in immigrant families are less discussed and heard in public spaces. And those research focusing on children with disabilities in immigrant families, I think they will probably, or they're very likely to become disabled parents in the future. So I think this topic is really important and really timely. And we also want to acknowledge that parents with disabilities are a very diverse group. Their experience will differ in terms of immigration, citizenship status, ethnicity, socioeconomic status, disability severity, etc. I feel I've been talking a lot, but here is the key of our webinar today, our awesome panelists. We are joined by Angie and Jennifer. So let me pull their bio real quick. Angie is a mom with APER syndrome of a 3-year-old daughter who also have APER syndrome, and she and her husband, who is from Mexico, they're married for 6 years, and they also have a late son, RJ. Angie was born and raised in Philippines, and then moved to the U.S. when she was an older child. Jenny is a mom with cerebral palsy, and she has a 13-year-old son. Here we also have a beautiful picture of Angie and her family in the slides. So I'll stop sharing now and then really welcome our panelists. Hi, Angie and Aggie, Jenny. So we have prepared a list of different discussion questions, and I also welcome our audience. If you have any questions, please feel free to type in the chat. And we hope to have some time, at the end for Q&A as well. So I will get it started. The discussion questions. Jenny and Angie, do you mind? Can you share a little bit with us about your background, or just tell a bit about yourself?
So do you want to go first, Angie, or do you want me to go first?
You can go first.
Okay. So my name is Jennifer Senda. I was born to immigrant parents from Mexico. I was born in 1982. They both immigrated in 1979. They did not come here knowing the language. I probably translated from my mother and interpreted up until I was maybe 12 years old. And we joke with my mom that her accent is still as thick as chocolate because it's very thick. She did not know that I had CP. She thought I was not diagnosed until I was 18 months old. And when I was diagnosed, she didn't know the complications or the symptoms or anything. She was only 21 years old when I was born. So, and they came here. They are citizens now, but they came here undocumented. So they did not know what to do. She was alone. So, it's kind of a different kind of situation now as a mother, and relating to that fear, the way I was, the way I came into the world and my mother was scared, and there was a different aspect of fear becoming a parent, having a disability, because they don't look at, when people think of parents with disabilities, they don't necessarily see, they, how can I put this? They see parents as becoming disabled later in life as they get older versus being born or having a disability at a young age and then becoming a parent. And I do have a 13-year-old son. He has ADHD, so I'm always on the go.
Thank you, Jenny. Angie, do you want to go next?
Yes. So my family and I moved here, or technically moved to California from the Philippines when I was 9. And at first, we came to California on tourist visas. And and when we tried to get our first lawyer to get started on our legal visas to stay here, the lawyer had my parents meet in an alley, which should have given the first red flag as much as possible. And somehow the lawyer convinced them that he would help them get their papers, like my parents' papers. And the lawyer ran off with our money, with my parents' money. So we tried, like from the very beginning, we did try to do the things that we were supposed to do when we wanted to move here, but it just took longer and there was just so much adversity. And thankfully, it all worked out in the end, where my older sister, she got married, like for love, of course. And so she got her green card eventually. And then I got my green card after my daughter was born. And so and then finally my parents are now legal here also. So for most of my life, I did experience what it was like as an undocumented immigrant, but thankfully I didn't have to experience parenthood much as an undocumented immigrant, because when my son was born, it was already 2018, and we were already married for about a year. And when my daughter was born, like she was born, and thankfully emergency Medicaid helped pay for her bills, especially her NICU bills, which was so expensive. And then the whole entire time we've been working on and preparing for my green card interview. And so finally we got there. And I am thankful for that.
Thank you, Angie. Yeah, well, I see the diversity of our experience, the immigration, the journey of different kind of immigrants. I came here on a student visa, and then I know Jenny is like a kind of first generation immigrant, like born in an immigrant family. So I'm glad that we can represent different perspectives here as well. The next question is a little bit open-ended. I wonder what's your experience like to be a disabled and also disabled parent in an immigrant family. Angie, do you want to start?
I can start. So I think most of it has been positive. Like a lot of people have been, especially nowadays, 2023 versus 1992, have been more progressive and open-minded and modernized. But like, I still get like adversity, in mostly made out of like judgment and like criticism, especially behind my back. Like, so when my church found out that I was pregnant with RJ, my firstborn, a lot of the ladies that I actually grew up with, especially in like young women's group, like secretly said to my older sister and my mom, like, Marco and Angie are so selfish for having a child, and that is such backstabbing pain to me, especially since I grew up with them, and supposedly we would talk about like our futures a lot, like raising future families, like getting married and having families, and everything back then when I was a teenager was like sugar, spice, and everything nice kind of thing, like yay. But now, like as an adult on the other side, when we actually started our family, they do a 360 and they're like, no, like they're selfish. So that has been the hardest as well. But thankfully, we didn't really pay attention or like let it influence us too much, or else we wouldn't have the two beautiful children that we love so much today. And I think like also some accessibility, because for example, I have ABERT, and I have, with that comes visual impairment for me, and my husband also has ABERT, so basically he would have also been a perfect panelist for this webinar, but I called dibs. And so he's from Mexico, and he has ABERT syndrome, and he has epilepsy. So that means that he has to go 6 months seizure-free or before he can get his license back. And I just got my green card, and I'm visually impaired, so we don't have a car. And for example, for me, first I have to get my citizenship, to get Medicaid, to get glasses, to get my license, and then we gotta figure out, hey, we gotta save up money for a car. So it's a lot of hoops to jump through, but we'll get there. And as we got here to having a green card now, as that also involved jumping through a lot of hoops. And like little things here and there, like I think more on the disabled parents, like opening some stuff where I've learned to like, I have a pouch that I bring with me everywhere that I put in my diaper bag, and I keep a pair of like elementary school scissors in there. So because I have 2 fingers, so when my daughter or me needs something open and I can't open it with my bendy fingers, I use the scissors. And
Thank you, Angie. I
yeah.
think you covered a lot, and yeah, the perception of towards people with disabilities being parents in our society is not always very positive. I think a lot of research shows that as well. And you also, I'm glad that you perhaps in the future your husband can be a panelist for some other webinars and share his experience as well. Also want to, move to Jenny a little bit, to hear from Jenny, your experience as a disabled parent in an immigrant.
Yeah, I agree with Angie in a lot of the perception. For me, there was perception because, I obviously, I look like my parents. My parents are immigrants. So sometimes I don't know if Angie gets this too, but people tend to talk to me very, very slowly as if I don't understand. And I'm like, I completely understand. I can speak, read, and write two languages. Like I can understand. Um, there was a lot of fear, and I don't know if Angie's gone through this, but there was a lot of fear, especially in our communities when we became pregnant, because for me, the medical professionals did not know how to handle having a pregnant woman with a disability. I mean, I live in Kansas, so it's kind of, they say, California is a little bit more progressive. Maybe the East Coast is a little bit more progressive. I live in the Midwest. So where New York is and where California is, we're like 20 years behind in terms of disability and inclusion and acceptance of various different, various groups. So it's a little bit, you still have to ask here, is it accessible? Is there wheelchair access? Is there, if my mom has to take him to the doctor, will the doctor explain it in terms that she can understand? Or will the doctor treat her, differently because, she's Latina, her accent, she understands and she's fluent, but because her accent is so thick, they think she doesn't understand. And so I kind of lose my patience with people because she completely understands. It's just her accent is thicker, than the average person. So she completely understands. It's just, I've gotten questions as there's a lot of preconceived notions and a lot of prejudice when it comes to immigrant families, and especially you compound it with the disability, then you're like, oh, does she really know what she's talking about? Yes, I do. I'm his mother. I'm his mother. I take care of my child.
Thank you, Jenny. Well, that's I think, yeah, what you shared resonated with my experience as well. Like, it's very relatable. I know, you mentioned that the geographic region of Kansas and the accessibility there, and even maybe, I think based on research, most immigrants reside in major metropolitan areas, or I think the top 3 states of immigrants residing area are California, New York, and Texas. So people in those regions were maybe more familiar with interacting with immigrants, but then in some areas that's less populated with immigrants, and then people's bias or unfamiliarity will be more. So yeah. I know right now it's school season, school starting, and then you have a 3-year-old and a 13-year-old. I also want to hear about your interactions with, school communities. How is your experience there? Who wants to start? Maybe Jenny first this time.
Okay, so my son is 13, and he's actually in the next room because we chose virtual school for personal reasons, because I can't get to his school as quickly as I would want. And like I said, he has ADHD. So, and he very possibly is on the spectrum as well. So for me, it's more convenient and more feasible to help him as a home educator and as a support system for him here. And then he goes to different groups through the community for socialization and such as that. But for me, like first through maybe kindergarten through fifth grade, it was terrifying. Sometimes they would get the bus stop incorrect, or they would say something along the lines of we can make it more accessible for the child, but we can't make it accessible for you. So the bus stop would be like 5 or 6 blocks away, and I would have to walk my ADHD son to the bus stop on sidewalks that are not reliable, and it's dangerous. Like it's a safety hazard. So finally we had to like stop. We had to stop because there's no way. Like this is more feasible. It works more on his schedule. Like he can get up. We have an Echo. So from like Amazon Echo. So he has a schedule where it says, okay, you have to go to class at this time. You get lunch at this time. You have to take your meds at this time, and so on and so forth. So I don't have to be on him or on his routine like throughout the day without he has reminders. But like school can make it very difficult. Like his school, I was telling the panelists yesterday and the facilitator yesterday that school can be difficult, especially because so many people believe and still enforce the grandfather law, where if a building is built before a certain time, it doesn't have to be made accessible. So yeah, it's very frustrating.
Yeah. I mean, I know disabled parents a lot of time, find alternatives, adaptations, but still, we have to navigate so much of this inaccessible environment, including schools. And then that can change our, the experience of our kids who may be disabled or not disabled. Yeah. Angie, do you want to share your experience with, starting your kid to school, 3-year-old?
So I'm a newbie, and I totally relate to Jennifer's perils, especially about the bus, because my 3-year-old, so just upon 33, she graduated from her early intervention program and her early head start program, and we did the whole team transition meeting to the school districts and into jumping into the world of IEPs and all of that. And so far it's been pretty positive, but there has been humanistic frustrations. For example, just like Jennifer, like, we're dealing with a bus unfortunately right now where so at the beginning of this month or this summer even, we thought Nina was going to school A, and we were so excited, and we posted school A was in a neighborhood that I'm a part of its Facebook group. So this neighborhood has a Facebook group. And so we did what many other parents of kids with Asperger's syndrome, facial differences, and other disabilities do. And we did a little introduction saying like, hey, Mina's going to school A and she'll be entering preschool and she has Asperger's syndrome. And we know that kids are curious or even shy or even scared. So we welcome you to come up and say hi. And everyone has been so welcoming and so excited for us. And then we find out this past weekend that Mina was not going to school A, but school B, because school A does not have a school bus and school B does. And school starts, or preschool starts next week. And if she had gone forward and gone to school A, we would have attended the Zoom orientation, which was right before this meeting. And so we are fresh, raw in the midst of a parents with disabilities like challenge right now. But I choose to keep positive and say like, hey, I that post did not go to waste because it's good to raise awareness that there is a child, incoming school child with a facial difference in the community that we are in, and we are bound to see our neighbors around in the common areas like the mall. And I, of course, we are all encouraged to believe that whatever school our children go to will be a good school that will be good to them. And so it's been positive, but with its own set of challenges.
Yeah. I think from both of your sharing and some of my conversation with disabled women in China with children with disabilities, schools often just, consider, okay, how can I make it accessible to our, your children who are disabled? But then they rarely consider how can you make school environment accessible to their parents who may have a disability. It's just the lack of perspective from disabled parents. So I really appreciate your sharing there. It reminds me of this woman's experience who is blind, and her child go to a school for the like a special school for the blind as well. And whenever there's resources for her kids, it's not accessible to the parent who is blind. She cannot use her screen reader or whatever to access those information, and that can really impedes the children's experience as well, right? As well as the parenting experience there. Thank you for, I see some of our suggestions and then, resource sharing in the chat. Thank you for sharing those. I'll pull the next question. Besides the school environment, I wonder how is your experience with other communities in your environment, if you have any there, like family relationship. I know Angie shared a little bit earlier about how, when you were pregnant, you were perceived negatively by the parents. Do you have other, like, how does that perception evolve?
So do you want to start? Yeah.
You go ahead, Angie.
Okay. So it's been positive, and I'm gonna focus on the medical community and thirdly the medical group. And so when Nina was born, she was in the NICU, and the nurses and doctors and all the medical staff were actually very positive, and they actually wanted to learn from us and hear what our parents did. And so I shared the experience of when I was a baby. I have high arch cleft palate, which means there's like a roof or a hole in the roof of my mouth kind of thing. And this was in the Philippines. And so whenever my parents tried to feed me, milk would come out through my nose. So my father figured out that, if we feed her milk through the eyedropper and have her kind of like be like in like a slanted position, like in a raised position, she will not have milk come out of her nose. And so obviously it was 2020. The world has evolved, and there's this wonderful invention of Dr. Brown bottles. And so that replaced the eyedropper, thankfully, and modernized and sped up or made caring for Mina a little bit easier. But we still shared with them, and they still vigorously studied or inhaled the idea of like, hey, let's have Mina be in a slanted position, in like an upright position whenever we feed her. And they took it and ran with it. They put it in the notes, in the nurse's notes. They put it in all her records and everything. Like, basically, they're like, whenever Marco and Angie says, like, do it, because they've experienced it, and now we're all experiencing, or we're all interacting with it with baby Mina. And so it's been pretty positive. And then as she grew up, or as she grows up, obviously she is going through the same journey, medical journey that we went through, especially with craniofacial surgeries and finger separation surgeries. And my hands are a little bit unique from the other APER hands of people with APER, because my pinkies and thumbs can bend. And for example, my own husband, who has the same exact situation syndrome as I do, and he's my husband, he unfortunately cannot bend his thumbs and pinkies. And so when we met with the hand surgeon, or Mina hand surgeon, he was actually like amazed at my hand. And when she's like, oh, so you had not only your hands, your thumbs and fingers, your thumbs and pinky separated, but you had your index finger, pointer finger separated too. And I replied, yeah, but it doesn't bend like my pinkies bend. But I'm honestly still glad that we did it, because it helps with typing and fingerprinting, especially fingerprinting, when it came to the biometrics for my application. So it was almost really cute how he was like feeling my hands, and he's like, okay, like, we'll do Venus hands like your left hand. And Mark, my husband, was like, no, let's just separate all of them. Yeah. And so it's been pretty interesting, but obviously it has its hardships, like with her cranial vault extraction. They cut open across her skull, and they put like expanders or distractors that we twist, and like she would have metal things sticking out of her, like the frontal part of her head, and we would have to twist it to expand the contraption right here. And it was slightly hard for us, slightly interesting, because out of the two of us, I'm the only one with dexterity in my thumbs and pinkies. But somehow Marco ended up doing it because he's a dad, and dads do the hard stuff. So it's been interesting.
Yeah. Well, I'm glad that Genji, you brought up your interactions, your experience with the health care environment and the medical communities. Actually, we have a question coming from the audience as well. Similar to that, I wonder, Jenny, can also if you can share a bit about your experience there. How has it been interacting with the healthcare environments for your children, especially?
Okay. So for me, it was more difficult when Edward was born. Edward, he was born at 37 weeks, which is kind of like right at the borderline. And Edward is always in a rush, has always been in a rush ever since probably conception, has always been in a rush. So he was 3 weeks early.
I'm not always in a rush.
That was him, by the way. um, he's he's such a joy. Has always been, he's the biggest blessing I could possibly have, sometimes the biggest headache. Edward, that dealing with the staff when I was pregnant was a little bit easier than dealing with staff after postnatal, because he actually lost weight. He lost about a little bit more than a pound after birth, and he was only 5 pounds 8 ounces at birth. So they were concerned about failure to thrive and such things. But I had to jump through hoops, pretty much literally, to be able to take him home. So my experience with medical professionals and hormones and bringing a new baby home was not the most positive, but I did learn from that. I learned to not be afraid to advocate for myself, and to be able to speak up when something doesn't feel quite right. For example, when he was diagnosed, they suspected ADHD at age 3. He didn't really get diagnosed until about age 6.5. When I finally told his pediatrician, you know what, he's not, and I don't like to say the word normal. Normal has a lot of connotations, but he has a lot more energy than what the average kid would. He's bouncing off the walls. I call him a little pinball machine. I tell him, you have a Ferrari brain with Chevy brakes, calm down a little bit. And finally we did a test for ADHD, and he was diagnosed. As he got older, people were like, oh, you're his mom. Okay, you're his mom, but at first it was like, oh, you're his mom. I'm like, yes, I'm his mother. I carried him. He's my child. And I think it's a little bit of a difference because my husband does not have a disability, like a visible disability. So it's a little bit of a difference. Like, I had comments from the nurses say, oh, he's gonna leave her, and they didn't think I heard. Yeah, so I'm like, okay, like, that's mean. Like, people need to learn to, especially people in the medical profession, they need to learn to filter what they say. You can keep your opinions to yourself, because if it's not relevant to care, they shouldn't be spoken out loud. That's my take on the whole thing.
Thank you, Jenny. Yeah, I think my experience with medical care professionals have neither been the most positive ones. I've shared some of those in my blog. I also wonder, as an immigrant, because my parents and then my husband's parents are all overseas, and it's not easy to travel, internationally to support with childcare. And then for me to bring my child to either China or, my husband's country, home country, India, there's a lot of paperwork to go through. I wonder, what's your childcare experience like, being disabled in an immigrant family?
So I'm going to start first. Just, I have the most wonderful family. I think that's the beautiful thing about being immigrants and coming from other countries, is that family is like your basis, your foundation. my parents were very adamant in us never forgetting our roots. Like, we listen to music, we read books in Spanish. I taught my brother and my sister to read, and I was fortunate enough to give my parents their first grandchild, or as they say, you gave him to us. He is the light of their lives. He is the sun. We, you know, they they revolve around him. Everything is around Edward's access. So I was very, very lucky in that sense of I had my family with me. But it's also unlucky because sometimes, because you're disabled, they have so much fear in the fact of what you can't do that they kind of focus on what you can't do versus what you can. You know what I mean? So it's kind of like a catch-22 there. Like, I'm grateful for the support and the love, but sometimes they kind of overstep.
Yeah, definitely.
And then speaking on going to another country, we took Edward when he was about 11 months old to Mexico,
Wow.
to Baja California, where my dad is from. And I got so many stares because he's an 11-month-old calling me mom. And they're just like, whoa, like, she's his mom? And I'm like, yeah, like, I'm the mom. I think they were looking at me like some religious icon or something. And I'm just like, no, it happened like normal humans do. It wasn't like, yeah, no.
Yeah. Well,
It was an interesting experience, to say the
Yeah.
least.
Yeah, definitely. Yeah, sorry. I'm still like just so drawn to your experience and how absurd people's reaction has been to you as a parent. How Jenny, you are muted. Yeah.
I'm sorry. It's been interesting. That's to put it mildly.
Yeah. Angie, do you have like, how about you? Do you want to share something there?
So my family and we actually live in Utah, and my parents and all the siblings that are here in America are in Southern California. Bless, bless them that they are actually fine during the Southern California hurricane right now. And my in-laws all live in Texas. My parents-in-law live in Brownsville, and the brothers live in the rest of Texas and Virginia. So like it's been a great big opportunity of independence, but thankfully Marco and I both have extended families here. Marco has uncles, an uncle and a cousin here, and I have like 3 uncles, but I never see them because they're also doctors, and so they're either working or flying out of the country. And but we have great neighbors, and since we all have ACRE, there's a strong family community of other families who have kids with APER syndrome that has also been family to us here. But I do credit both of our parents for helping out during the first leg of our parenthood journey for both our children. So as Abby has mentioned, we have a late son, RJ. He only made it to 28 weeks, and he only lived for 1 day, and we miss him every day. And after when RJ was born, he was, of course, born in such an unexpected time. So basically, Marco's mom and my parents both rushed from Texas and California to Utah to be with us and get as much time and meet RJ as much as possible. And so they stayed through the one day that he lived. Well, my parents only made it to our hospital after he passed away, but they still spent time with him, and they stayed through the funeral and all that, and a little bit afterwards, and helped make sure that I was okay, and we have a friend, like all our April communities, they're all non-cranial parents, and so they just have children with Beaver syndrome like us. And I have this one mom friend that when RJ died and we were still in the hospital, she came to our house after she dropped off Marco with his house team, and she got all the baby stuff that was gathered for him out of the house for us, so that when we come home without RJ from the hospital, we didn't have to see all the baby stuff. And so when Nina was born, like both like once again both potential parents came, but only Marco's mom came. And my parents stayed for about a week, and thankfully it was right after she came home from the NICU. And they helped us with rides and food and settling in. And Marco's mom came after they left, and she stayed for about a month, and she actually helped me like latch on with breastfeeding Mina, even though she has her cleft palate, but basically they both supported the idea that, hey, our children are parents, we support them, we love them, they can do it, kind of thing. And
thank you. And
yeah,
I want to just given consideration of time as well, thank you for sharing that experience of yours. And I'm sorry to hear that as well, but we also have a question from audience. I want to bring that up as well. So this question is, how do you respond to people when they question you having a child when you're already on Medicaid and bringing into the world another child will be dependent on Medicaid? Or how do you respond to people who question your decision to bring into the world a child with a disability when it may entail a life of suffering? Is this stigma even greater because you are immigrants and not white?
Did I go first since my microphone's already on? Well, as Marco would say, and Joey from France, like, like it is what it is, and it's our life, and many parents or many adults with disabilities, even though they may look severely different on the outside, on the inside, as long as they're financially capable and like honestly have a good hand on their shoulders and highly functioning, like we can do it, kind of thing.
I think disabled parents have to have this will be faced with a lot of ableist questions and in our environment, and we need to defend ourselves. We found ourselves in a lot of situations that we have to defend ourselves.
Yeah, and like as I like what our therapist had to say, which is your opinion is just your opinion. Your opinion is not a fact. and I love that. And as for Medicaid and the suffering, like Mina is a happy, normal, go-lucky girl. She loves flipping and Coco Melon. She, when we get a lot of comments, thankfully, from supporters saying that she looks like one happy girl, and I know her inside out as her mother, and I'm like, she doesn't look like she's suffering. She doesn't act like she's suffering. So we're good. And when COVID hit, she had COVID, and the worst thing was those late night coughs that will wake her up, and like it would be really bad. But thankfully, that's it. So I think pe- people are still learning, especially some people more than others, that just because you look extremely different, doesn't mean that you're sick. I think that's one important thing that we should all like emphasize as parents or even as people with disabilities, because they're healthy, they're happy, they're healthy, they're walking, or like they can do stuff like in their own time, in their own ways, but they could still do it. And the world needs more of them, or the world needs them to continue to see the beauty in the world.
Mhm. Thank you for sharing those powerful words, Angie. It reminds me of a quote, I think, after I had a surgery and I was on crutches and wheelchair for half a year. I think the sentence was, pain is inevitable, but suffering is not. Like, a child who may have a physical difference or whatever difference, but, you can't assume that they are just suffering. You can't impose that assumption on them. Yeah. Jenny, do you want to, I know we are running out of time, but so maybe briefly, Jenny, do you want to respond to the question?
Yes. First of all, I'm going to be honest and say it's a kind of a triggering question because I've never met anybody as joyful as my son. And for him seeing me and use my wheelchair, it's completely just part of day-to-day life. Mom needs her wheelchair. Mom doesn't drive. Mom, has to have stuff where she can reach it to be able to do things. But I'm still his mother. I don't think anybody has the right to define what makes a good parent or not. Unless a child is placed in imminent danger, disability has a way of broadening your perspective. So we have a saying in our house: we adapt and roll. If something doesn't work one way, we find another way to do it, but it always gets done.
Thank you, Jenny. Yeah, I think disabled parents really have a lot to offer and a lot to, teach, educate us. So with that, I want to end our webinar. I know we're running out of time, but please stay connected. We're on social media, and we have, a lot of resources to share with other parents with disabilities or non-disabled parents with non-disabled parents or other professionals. Would love to hear from you about feedback on our webinar and our future events. With that, I really want to thank you all those interpreters supporting our event, and also Jenny and Angie for educating us on this topic. Thank you.
Thank you for having us.
Thank you. Feel free to,
Thank you.
Future questions, feel free to reach out to Lurie. I will share my the contact info here again, just so you have it. Thank you.